morning, everyone. Today I am going to present about the genetical disorder that is called hemophilia. Next, please. So, hemophilia is also spelled hemophilia down, but is a mostly inherited genetic disorder. So no one can actually catch hemophilia. It's an inherited condition from birth that you get from your parents, and that impairs the body's ability to make blood clots, a process that is needed to stop bleeding. Hemophilia is also a lifelong disorder, which means a person born with hemophilia will have it for life. This results in people bleeding longer after an injury, easy bruising, and increased risk of bleeding inside joints or the brain. Those with a mild case of the disease may have symptoms only after an accident or during surgery. Bleeding into a joint can result in permanent damage, while bleeding in the brain can result in long-term headaches, seizures, or a decreased level of consciousness. Hemophilia A occurs in 7,500 males, and hemophilia B occurs in 1 in 40,000 for males, because hemophilia B is rarer than hemophilia A. Next. And now I'm going to tell you the difference between a person with hemophilia and a person that doesn't have hemophilia. So, a normal person, when he's bleeding, so example, you cut yourself or anything, blood cells called platelets gather at the injury and the opening that you accidentally cut yourself, and other blood parts called clotting factors help hold the platelets together to form a clot to stop the bleeding. So the bleeding does not continue anymore. But the case is different for people with hemophilia. When a person has hemophilia, he doesn't have enough clotting factors that is needed to form a clot that's making the bleeding longer, because the blood clots cannot form to close the bleeding, thus making the bleeding longer. And there are types of hemophilia. There are two types of hemophilia. The first one is hemophilia A, which is the most common type of hemophilia. And the hemophilia A means that this person does not have enough clotting factors 8. And a less common type of hemophilia is hemophilia B. This person does not have enough clotting factor 9, but the results are still the same. People with hemophilia A and B, they both bleed longer for better than normal people. Next. The symptoms. Signs and symptoms of hemophilia vary depending on your level of clotting factors. If your clotting factor level is mildly reduced, you may bleed only after surgery or trauma. If your deficiency is severe, you may experience spontaneous bleeding. Signs and symptoms of spontaneous bleeding include unexplained excessive bleeding from cuts or injuries, or after an injury or dental work, many large or deep bruises, unusual bleeding after vaccination, pain, swelling or tightness in your joint, blood in your urine, or stool, nosebleeds without a known cause in infants, unexplained irrationality. Is there a cure for hemophilia? No. Gene therapy remains the exciting possibility that holds out the prospect of partial or complete cure. There are many technical obstacles to overcome, but research currently underway is encouraging. Technically, a liver can cure hemophilia since coagulation factors are produced by cells inside the liver. However, the risk of surgery and the requirement for lifelong medication to prevent rejection of the transplanted organ may outweigh the benefits. Next. But, however, there are treatments. Several different types of clotting factors are associated with different varieties of hemophilia. The main treatment for severe hemophilia involves receiving replacement of the specific clotting factor that you need to cover the bleeding, and a tube placed in the vein. This replacement therapy can give to a bleeding episode that's in progress. It can also be administered on a regular schedule at home to help prevent bleeding episodes. Some people receive continuous replacement therapy. Replacement clotting factors can be made from donated blood. Similar products called become Bina clotting factors aren't made from human blood. Other therapies may include the molpressine. In multiple hemophilia, this hormone can stimulate your body to release more clotting factors. It can be injected slowly into a vein or provided as a nasal spray, clot-preserving medications. These medications help prevent clots from breaking down fibrin sealings. These medications can be applied directly to the wound sites to promote clotting and healing. Fibrin sealants are especially useful in dental therapy. Physical therapy, it can ease signs and symptoms. If internal bleeding has damaged your joints, if internal bleeding has caused severe damage, you may need surgery. First aid for minor cuts, using pressure and a bandage will generally take care of the bleeding that is severe. For small areas of bleeding beneath the skin, use an ice pack. Ice packs can be used to slow down minor bleeding in the mouth. Vaccinations, although blood products are screened, it is still possible for someone who relies on them to contract diseases. If you have hemophilia, consider receiving immunizations against hepatitis A and B. And I think that's all for my presentation. Thank you for listening.